Hi, welcome to this channel. This channel is about educating patients on their rights and at the same time discussing with fellow medics on how to give a quality health care. Honestly, the patients that have come across, majority of them have turned out to be lazy. Lazy in the sense that they don't know the type of medications that they are on. They don't know the disease that they're suffering from at depth, and they don't even know not just the names of the medication, but even the purpose of the medication that they're having. Most of the time, patient would walk in for a drug refill or medication top up, and they would expect you as a doctor to refill the drugs without you telling them what drugs they are on. They expect you to go through their history in order to know what medication they are on, refill, and then give them. You ask them, do you even know that any single medication that you are on? No, I don't know. Let me ring somebody to send me a list or to tell me, because I forgot the last prescription that I had. You see, it's quite interesting and annoying at the same time, because I'm not the one who is sick. You are the one who is sick. Today you come to me, the systems are up and working. I would be able to go through your history and retrieve what medication you are on. Next time you come here and the systems are not working, something happened to it and all that, how would you expect me to know what medication you are on? You know, so it brings all a lot of hassling and all that, because one way or the other you'll be forced to go home, get that list that the drugs you're on, if it's at all intact, and all that. Anyways, my advice to patient is that you should be able to know what kind of medication you are on and the reason as to why you are on those medications. Most importantly, you should know the disease or diseases that you're suffering from. Okay, if you, for instance, you're suffering from hypertension, then you should be able to know that why you are on a certain medication. Okay, there are people who would walk in with a list of with a drug list of at least 4 to 5 medications, and they don't know why they're having or they're taking all those medications, while there are people with similar diseases or similar disease that are taking lesser medication. Okay, or even more. So I find it very annoying when patients don't know their diseases, because it's out of ignorance. We are educated, Kenyans are educated. You should be able to know what kind of medications you are on. I was educated from a place where patients would walk in and they would tell you, I'm on this medication, this and this medication. I used to be on a certain medication, but it was removed. Yes, I stopped because of ABCD. Okay, so and this patient will not be young. Some are even older or quite old enough that you wouldn't even believe that they would be able to know the medication, or they'll be able to give you a history from when the disease started and to where it is right now. But you come here and people are so young. Okay, someone is actually new to the disease, 3 to 5 years from the time they started suffering from that disease, but they wouldn't even be able to tell you the number of medication they were on, and or the current medication that they are on. So I find our patients being too lazy, which is literally not good. You need to know your disease quite well. Technology is on the highest right now. You can just Google, about your disease, the kind of medication that you are taking. If you react to a certain medication, if you react to medication, you'll be able to know what kind of medication, or the name of the medication that you've reacted to. Okay, yeah, so it is your right. It is good when you know your disease and you know the kind of medication that you are on. I would advise patients to learn the names of the medication that they are on, the purpose of those medication, and at least, you know, with those medication, you'll be able to know if those medication are helping you, if those medication are not helping you. In fact, it is your right to ask the doctor, what kind of a disease is this that I'm suffering, so that the doctor can explain to you clearly, for you to leave the office when you know exactly what is wrong, or what the disease is all about, and how to prevent further damage, further complications, and all that. It is your right to ask the doctor, why am I on this medication? What is the purpose of this medication? Medication number one, medication number two, number three, so that you go home knowing that if I don't take this medication, if I'm feeling like this, it's because I didn't take this type of medication, or I'm taking these 4 tablets because tablet 1 is for this purpose, tablet 2 is for this purpose, 3 for this purpose, and 4 for this purpose. So stop being lazy. It is your right, because you need to know what kind of medication you're on. You need to know your disease well. You are the only one who can help yourself to heal faster, or to prevent the complications. Our work would be to ensure that we give you the right medication, we help you up, but it is up to you to help yourself. Okay, nice. Bye bye. See you next time.